I moved up to Rockhampton in 2003, and what attracted me was the great opportunities in a regional area in Queensland. I'm a Queenslander originally, had lived in New South Wales and overseas, and was really keen to get back to a regional area, and yeah, lots of opportunities arose.
Emerald's a really vibrant little community. I know that one of my biggest fears coming here was being isolated from family and friends, but once you start working in a small community hospital, you definitely build up such a great rapport with all the staff, and I know I can walk down the hallway now and be able to, say hello to everybody by name, and they know me as well.
Everyone is so friendly and embracing. I really enjoyed the culture here in the rural environment. They make me feel immediately part of the team. I'm actually surprised that I didn't know how much I'd settle into a small town.
The biggest encouragement to stay with Queensland Health is the people that I get to work with. I've been working at Billawheeler Hospital for 2 years now, and it's both a really busy place and exciting place to work, but also a place where you feel like the people that you work with are your family in a way.
I feel like health professionals here in Blackwell are quite well respected, and that respect is also returned to the members of the community.
Already having ties in the community in regards to family but also sporting endeavours, staying here and working in my community has been the obvious choice, and that has been made easier by my leadership encouraging me to further my career and ensuring that I'm keeping my training and my skills up as well.
My colleagues are friendly, they're positive towards me, I get good response from people, I feel accepted, and there's a lot of opportunities here.
Probably the biggest draw card to working out here is the fact that it is a centre of excellence for rural generalism. It's the place to be if you want to be a rural generalist trainee. You get the experience and the exposure to make you a better doctor. You'll see cases that will prepare you for your training, and you really do get to see a full breadth of practice.
So there's a really supportive learning and development culture within the HHS. There's management development programs, clinical leadership programs available at any level.
It's a very large organisation, very diverse, and there's lots of different pathways you can go down to help your career.
We like to support you for any additional education, if you are undertaking any postgraduate studies.
The commitment of management to ensuring that my skills are up to date with current guidelines and protocols is fantastic. I'm actually on my way to Brisbane in a couple of weeks to spend 2 weeks in a neonatal nursery taking care of sick bubbies to upskill myself and ensure that I'm able to provide that care out in Emerald.
The universities here includes the CQ University, which has its own range of topics of advanced specialisation and reputation. There are flights to any part of the country from here, and Brisbane is just an hour away by a flight.
So Destination 2030 has just really been about improving ourselves as a hospital and strategically breaking down everything so that we're constantly improving the great care we provide to our great patients.
We're talking more about our vision and our values now, which is great. We are thinking about how we can make this place the best for our patients and continuously striving to improve this place for our staff.
There's been a massive culture change within CQ Health. There's been a very important 4 standards that we live by: respect, commitment, care and integrity. That's really the basis of our values that we provide to our patients and how we act towards each other.
I'm very impressed by the organizational culture because they're very responsive, they're very forward-looking, they want to know what your concerns are, and they want to hear, listen, investigate it and put supports in place.
Leadership has been able to look at not just in terms of clinical service delivery, they looked at things like what provides satisfaction to the staff and making sure that there is a good voice for the staff to be able to feedback, and that's reflected in the staff surveys and the outcomes that we are being seen in the staff saying they're feeling respected and valued.
What's kept me working in CQ is the great people that we work for. It's always nice to be working for a great organisation. There's been lots of opportunities for career progression and succession planning for staff out here, which is great, particularly in the rural areas.
When everything starts working together, patient care can only prosper from that.
So Banana is the Shire of opportunity, and certainly that rings true for career advancement within health, certainly with CQHHS.
In the past there's been an increase of Indigenous jobs and a lot of opportunities for Indigenous staff, and working towards this will help close the gap.
It's a real community up here, and it's good to sort of have a lot of support when you're starting off in a new career.
I've got flexible work arrangements within work, which helps me with life outside of work as well.
I'd heard that the region was beautiful, really close to the southern Great Barrier Reef, and that my scope of practice would be much more vast here because it's a regional area than if I was based in Brisbane, which is where my family's from. I was just really attracted to improving my experience and knowledge by coming to a regional area.
I feel like I fit in here, and I feel there's a lot of opportunities for me.
You know, it's not what I expected. It's a great laid-back place to live. It's got everything you need. Beach is 20 minutes away. The organisation's great to work for. Good career development opportunities. Come and try it. What's the worst that can happen?
Sounds too good to be true. I hear this all the time, and it's not too good to be true. It's real. It's real. It's actually life-changing.
I had a 5-year plan to move here and to move back to a metropolitan region, but really Central Queensland has captured my heart. It's a great place to live and grow and develop as a clinician, and I see myself staying here for many years ahead into the future, and I hope you'll come and join me.